Hello and welcome to the situation report for Thunder Bay Regional Health Sciences Center's COVID-19 response. My name is Tracie Smith. Today is November 17th, and I am here with Incident Manager Dr. Stewart Kennedy. Dr. Kennedy, we don't have a lot of really positive news in terms of what's happening with cases in our community today. We're currently at 56 confirmed positive cases of COVID-19 in our community. What is the impact of that on our hospital here?
Well, at this stage, Tracie, we have no COVID-19 in our hospital. So having 56 in the community, we're quite fortunate that no one is in the hospital. They're all at home self-isolating, along with a number of other presumptive cases. The health unit has been identified, and the health unit has done an amazing job searching down these contacts over the weekend, telling them to self-isolate and not go back out into the community. And at this point in time, we know many of these individuals are symptomatic, but at this point in time, they have not required emergency or hospitalization, which is good news for this point in time. But I do believe at some point in time we are going to get some COVID-19 in the hospital, and we are well prepared for the influx of COVID-19 into our hospital. But I hope it doesn't happen.
I think everybody's on board with that. We hope it doesn't happen, but it certainly could, and we are prepared for that. And I want to reiterate, too, the amount of work by our public health team in tracing these cases and providing that information to everyone. It's just been phenomenal.
It is also interesting, Tracie, when we actually have an increased number in the community, we as IMT sit down and meet more frequently. And what we do is we go through a trigger document. So each time we have a number of cases in the community, well, right now we're in code red, or we're sort of code red for our trigger document. That just allows us to look at what are we going to do with our learners, what are we going to do with our visitor restrictions, what are we going to do with our surgery, what are we going to do with our diagnostics. And we have, at this point in time, have not made any significant changes in our delivery of service, but we have actually made our visitor policy more restrictive, in that we now are just have eliminated care partners, as discussed last week, and we're going to continue with the essential care partners. So we go through this document every week to make sure we keep this hospital environment safe. And sort of the next big trigger, the next big zone, is when we get a number of COVID-19 patients in the hospital. But so far, we've been fine.
Knock on wood. And I just want to be clear, that document and that code red, or that level red that you refer to, that is specific to our hospital. It's not the community status.
This is our document that we use internally for our decision making.
Great. Now, you did talk about services. We are offering surgeries, diagnostic procedures, still at over 100% of the usual volumes in order to catch up on those backlogs. Now, is that going to continue? Why aren't we just shutting everything down?
Trace, we've learned a lot since last March. And by shutting everything down, I mean, the easy answer, both for the public health unit, both for the government, both for, for all political parties, shut it down. It's more safe. The question I would have to say, is it more safe? The morbidity and mortality that we could experience with increased wait lists for our surgery, increased delayed diagnosis for our sort of patients out there who really need to be diagnosed and need to be treated. The burden of the disease, our mental health challenges are overwhelming when we shut everything down. We cannot just think of the immediate acute care crisis. We must think of the impact of our delivery of healthcare in the near future, and the outfall from not having the economics to buy food, increasing our food banks demand, the closing down small businesses, and the financial and the mental strain. That is long lasting. We are going to get a vaccine, and we've heard positive news over the past several weeks that we have two companies that are 95% effective, little side effects. So we are making some good progress with vaccines. So I got to fix my mask here, Tracie, which is positive news. When are they going to be available? I think we're working with a coordinated effort from the federal government, the provincial government. So I would hope, springtime we're going to have vaccines. So we just need to stay the course. And every individual is responsible for their health, their own health, their health of the family, and the health of others. The best protection that we have right now that we can sort of prevent the government from imposing restrictions on us is continue to wear your PPE. Continue to wear your mask when you're out. Continue to wash your hands. Continue to have this physical distancing. And it's stay home as much as possible. But if you do go out, make sure you follow all the public health rules. This is the best defense. You owe it to yourself, you owe it to the community, and you owe, more importantly, for the acute care health workers out there who put themselves at risk. So I think it does work. We've had some unfortunate incidents here in Thunder Bay that certainly has increased our prevalence in the community. But we can beat this, but if you just think about those public health measures, because they do work. We have multiple infectious disease experts saying shut it down. I think at this point in time for Thunder Bay, that's the wrong answer. We just have to keep on enforcing our public health policies and continue to be really vigilant of our public health measures.
It's easier to do that now than it was in the first wave as well, because we have masks now, right? Businesses have implemented initiatives like putting plexiglass in front of cashiers, things like that. So it is easier to follow those public health guidelines at the same time.
And we are going to have setbacks. This is a setback, and it's very unfortunate. But every year we have setbacks with the flu, that we unfortunately have high hospitalizations. We actually have to learn to live in the midst of these setbacks and continue to follow and be prudent by following the public health rules.
Now, speaking of public health, Medical Officer of Health Dr. Janet DeMille at the Thunder Bay District Health Unit yesterday, she really noted that people should keep their socializing to only people within their households. Will that help to flatten the curve? Is that something you support?
Absolutely. The less contacts you have, certainly the less possible exposure to COVID-19. So limitations of contacts is very important. And it's also important if you ever get COVID-19, it's easy to trace down those contacts for all of us. So limiting your exposure is certainly what we need to do during this period of time. But sometimes it's very difficult to limit the exposure. So if you are sort of going out to the shopping, which you have to do, if you have to go out and certainly visit long-term care individuals, but get your swab done. But the public health measures is still important. I mean, right now the arenas are open. Right now sporting events are open. Exercise areas are open. Restaurants are open. These are all small businesses. So if you and they're all taking their special precautions. So if you do go to one of these places, keep your mask on, making sure you're doing your physical distancing, and making sure that you're doing everything prudent, that everything you touch could be COVID-19, and wash your hands.
Now, what about travel? So we can implement restrictions specific to our hospital through screening, for example. What do you recommend for community members?
Well, certainly when you look at the Atlantic bubble, it's working over in the Atlantic bubble into our eastern partners. So the more you can limit travel, the more you can eliminate COVID coming into this community. So we're having that discussion today with IMT regarding right now we limit travel, or you would fail the screen coming to this hospital if you traveled outside of Northern Ontario. We're going to have the discussion to further restrict travel for our hospital employees and our staff to travel outside of Northwestern Ontario. And I think, again, the more we can sort of close our bubble a bit smaller, just like we close our contacts a bit smaller, I think it helps prevent the spread of COVID-19 and introducing more COVID-19 into our community. I know people are challenged with that, and certainly it'll be our recommendation, but I think it's a small part we can do to help protect both the environment of the hospital and our city.
Absolutely. Now, I worry a little bit that because of what's happening in the community and the amount of cases, that people will be afraid to come to our emergency department. In the first wave, we know that people avoided it, and what ended up happening is that some people became sicker. So what about our emergency department? Can people come to the emergency department? Is it safe?
We're always open for business, and certainly the staff there is well prepared. They're in full PPE, protecting you from them and them from you, and certainly we want to make sure that the emergency department stays open. That's why it's so important that people really protect the health of our healthcare workers to follow these public health protocols. But certainly, I mean, if you have a sniffle or runny nose and some minor symptoms, certainly call the assessment center for a test. Do not come to the hospital for that, to potentially spread COVID-19 to others in the hospital, and go back home and then self-isolate. So we're open for business. Certainly the minor ailments should be able to stay at home or call their primary care providers. But if you're having symptoms of COVID-19, do not come here unless your symptoms are major, with shortness of breath, as well as high fever. But other than that, stay at home, call the assessment center for a test, and you get a quick turnaround. Hopefully these days, the turnaround time is about 2 or 3 days now.
And you can get a same-day appointment.
And you're going to get a same-day appointment, yes.
Okay. So overarching, just to reiterate, what should people be doing right now to flatten the curve?
Take responsibility of yourself, take responsibility of your neighbor, and take responsibility of this community. And you did a very good job in March, April, May, June, July, August. We're slipping a bit, and so now we just have to be very cognizant of when you're going out, take all those public health precautions. And still the advice is, if you can, stay at home. But we understand human nature is sometimes you just need to get a break, both a mental break and a physical break, and that's okay as long as you take on your precautions.
Absolutely. So be cautious and be kind. Don't forget to respect one another. Thank you so much, Dr. Kennedy, and thank you for joining us.
Thank you.